Movement disorders are neurological conditions that affect the speed, fluency, quality, and ease of movement. Dr. Georgeta-Varga, a neurologist at Desert Regional Medical Center in Palm Springs, explains the different kinds of movement disorder.
Movement disorders are a group of diseases like Parkinson's disease, essential tremor, dystonia, Huntington disease, which are the most common, and many others like myoclonus or tics, Tourette's. And they're a group of disorders treated by neurologists with the movement disorder subspecialty. The most common movement disorder, in fact, is essential tremor, but that comes to the doctor's office not so often, because if it's not too disabling, the patient is not to complain. About 70% of what we see as a movement disorder specialist in the clinic is Parkinson's disease and what is called Parkinsonism. A patient with Parkinson's disease, after 7-10 years of disease progression, which is slowly deteriorating, will have less and less response to the medication and will have a lot of side effects from higher doses of medication that are required to relieve the symptoms. At that point, the patient comes to see me and screen for deep brain stimulator surgery. Deep brain stimulator is a surgical treatment. It consists in implanting leads in patient's brain, in certain areas of the brain that are involved in the pathology of the disorder. In order to place the leads in the optimal place with the most therapeutic benefit and less side effects, the neurologist has to do a brain mapping, meaning that is recording the brain electrical activity and find the ideal place to implant the leads. The advantage of the surgery is that besides that relieves the symptoms, it allows to lower the medication doses. And therefore, the side effects of higher dose of medication that have been used before the surgery are going to subside. Another movement disorder that benefits tremendously from deep brain stimulator is dystonia, and I'm talking about primary dystonia. Primary dystonia is a genetic disorder where usually is generalized, and in those cases, the deep brain stimulator can relieve the symptoms up to 90% without medication. They regain their lives. I had a patient that was ready to apply for disability papers before the surgery, and he was a stationary engineer, young, 54. And I refused to write his disability papers. I said, Mr. X, we do have the surgery. You have to think about this. And I explained him. He met with the neurosurgeon, with the whole DBS team, and he agreed with the surgery. After the surgery, 6 months after the surgery, he came back and he said, I want to go back to work. And I don't need the disability papers. Patient, how happy they are. I mean, I cannot describe. They come before the surgery and they're all disabled and ready to die because they think they're dead. And they got a surgery and they go back and, oh my God, they go back to work.